A very difficult day yesterday when we got the latest numbers on the coronavirus, both in Fayette County and statewide in Kentucky. And Dr. Kevin Cavanaugh from Health Watch USA is joining us. Dr. Cavanaugh, good morning.
Good morning, sir.
Highest daily rate of infections yet for the state of Kentucky. Do you think that's an anomaly, or is it a sign that we may be starting to move up like a lot of other states?
Well, I'm concerned of the latter. The 7-day average is also creeping up. Remember, at one point we were approaching almost a 7-day average of 100. Now we're approaching that of 300. We're at 268. And so it is creeping up. And so that's not good. And you combine that with what's going on in other states, and remembering this virus doesn't respect geographic boundaries, and the problem our citizens are having with grasping the public health advice of wearing masks, not gathering in crowds, and partying over the 4th of July like nothing has happened, all of that is a harbinger of not good things to be coming.
We had the highest number of individual cases, daily cases ever in Fayette County yesterday, and the local health department says at least some of that is because of people traveling.
Well, yes, and we had talked about that before, is that this virus doesn't respect geographic boundaries, and this is why you need to have a national strategy. But it's also why we need to be proactive, and when things are going bad in other areas, not to think it's going to not be here in Kentucky, because people travel and it'll come here. This virus has a long incubation period, so by the time you see rates or cases rising, you well could be in for 2 to 3 weeks of continuing rising in cases, hospitalizations, and going through an ordeal like these other states are going through. We need to take notice of what's happened before in other states. We didn't notice what happened in 1918 with the Spanish flu, or in China, or in the Northeast, and now in Texas. We still have people saying, it's not going to affect me, I'm not going to wear a mask.
One of the things that we're hearing about over the last couple of days, researchers in Spain are showing it, California, Sweden, the interviews on national media that Dr. Tom Hanks did yesterday, that some people are coming through this and yet don't have the store of antibodies in their system that we had originally thought they might have. So this speaks, I guess, not only to their ability to fight off this virus if it comes back, but I would assume that also speaks to the theory of herd immunity.
Yes, and it's concerning. Now, you still can have memory cells. So just because you don't have antibodies doesn't mean you won't be able to fight it off, but it's not a good sign to this early not still having antibodies. And this is what we've been saying again and again and again. Herd immunity is a false narrative. Number one, the virus is too infectious. You would need over 80% of the population to be immune before herd immunity would kick in. And number two, we do not have evidence that you will develop lasting immunity. We just don't know. And the early evidence we have is not that encouraging. The good news is the vaccines will actually augment the antibodies which you need to fight off the virus. In other words, it gives you a greater immune response than what you would get naturally. And this is what the initial trials with Pfizer have shown. So hopefully this vaccine will be both safe and effective for a long period of time. We just don't know yet. That's why we need to wear masks, because wearing masks and social distancing and good hand hygiene can defeat this virus alone. It will slowly drive down the cases. It won't provide you with 100% protection, but it will provide enough protection to drive down the viral cases so that as a community, we will start to see this epidemic wane. But people have to buy into this, and currently they're not. So that is my main message.
All right. Before we let you go, when you were on Monday, we had a listener text in and ask about the Zollinger Protocol.
Yeah, that is a protocol with hydroxychloroquine, azithromycin, and zinc. I would not recommend that protocol. The vast majority of studies have not been able to show that hydroxychloroquine is effective. That's number one. Number two is that it can cause heart problems with a prolonged QT interval. Well, guess what? Azithromycin, that antibiotic, causes the same heart problem. So if you combine the two, you're very, very likely get that problem. And that is one thing that some of the studies monitor for, and it is a problem. I have no idea why you would choose that antibiotic that has the same complications as hydroxychloroquine. To me, that makes no sense. So that's not a protocol personally I would recommend.
Dr. Kevin Kavanaugh, HealthWatch USA, what's that website?
It's healthwatchusa.org, and we also have healthconference.org.
All right. And we'll talk to you again on Friday morning.
Thank you, sir.